At Family Services, our vision is to have Vermont's children and youth live free from abuse and neglect and delinquency in resilient families. We do this through engaging communities, families, staff, and we really value communication and connection. So we are small but mighty.
We are a very collaborative small state. We are part of the Agency of Human Services. We are one division within the Department of Children and Families. There's a total of 1,100 employees for the whole department, and there's 450 within our Family Services division itself.
Family Services created a workforce development director position, so that was really, really exciting, but it wasn't until we had someone really intentionally able to focus on it that we could really start pulling in the data for our workforce.
So our primary workforce development goal that we're going to be partnering with QIC is to positively impact work satisfaction and retention of our workforce so that we can achieve better outcomes for both the families and the workforce. We strongly feel that that is a relationship that you cannot divide. We have some wonderful staff, and so we're trying to figure out how to better use our current data to figure out what strategies to focus on. And so we want to know where to really put our time because we have limited capacity to put into that.
We've learned that the majority of our staff who are leaving are reporting that it's due to the lack of work-life balance and or overall burnout. So again, I don't think that's terribly surprising to anybody, but we now have the data to sort of back that up and start understanding what we can do to impact those areas. We've also learned that by having some intentional focus on the ways that we are recruiting, we are starting to see some positive changes.
We were looking at how we can increase recruitment. What we saw is that by pulling data for a period of time before we made the changes to how we use social media, how we use tags, how we use sponsorships, then we were able to see the numbers for that and then compare that to what happened after our changes, and then we can make some really good informed decisions around what to do.
We're just so excited to have some support in this area because the turnover, the vacancy, the staff feeling safe in their work is what results in outcomes for staff, it's resulting in outcomes for our children, youth, and family, and resulting in outcomes for our states and jurisdictions. So I think, it's just so foundational to be able to focus on this work.